Summer will be here before you know it. But if you avoid wearing skirts or shorts because of unsightly, even painful leg veins, we've got help for you. Here to share more, we welcome back from Inovia Vein Specialty Centers, board-certified vascular surgeon Jason Gilster. Good to have you with us, Jason.
Good morning.
First of all, let's kind of get an understanding of what varicose veins are.
Varicose veins are those large, bulging blue veins that you'll see on the lower leg.
Yeah. And they're painful, right, for a lot of people?
Yeah, for a lot of people, they'll be associated with symptoms like itching or swelling or aching, sometimes restless legs.
And then in the past, how did people treat them? I know there was like compression stockings.
Yeah, compression stockings still do have their role,
Right.
but the traditional treatment was removal of the veins, or vein stripping, which was a kind of a big procedure.
Yeah, it sounds brutal.
Yeah.
But you have some quick outpatient treatments.
We do. We're now doing procedures right in the office using just local anesthetic, and they're about 20, 30-minute procedures.
And how much work can you get done? I mean, if the problem is pretty bad, pretty extensive, can you get a lot done?
We can. These
Okay.
procedures are very effective and very quick.
Yeah. Let's take a look at before and after, and then you tell me what we were seeing here.
Great. So what we're seeing there is some bulging varicose veins in the lower calf.
Right.
On the left side and on the right, you can see that they've essentially disappeared.
And so how long is the procedure? Oh,
Well,
wow, look at the difference.
yeah.
This is incredible.
Yeah, it'll take a few weeks to, maybe a month or so to see things change, but you can see things quite quickly.
Yeah. Is there any downtime? Is there any pain? Tell me about a little
There's
bit
a
about
little
that.
bruising and a little soreness, but essentially no downtime. You're able to get back to regular activity pretty quickly.
Yeah. I know that a male friend has had this done, and a lot of men get this done, right?
Yes, a lot of men do. It's thought that, in the
It was just
community
women.
that it's just women, but
Right.
it's a very common for both men and women.
And tell me about, does insurance cover this?
It does. Most commercial insurance does cover it, and Medicare covers it as well for symptomatic veins.
You've got to be pretty pleased that this is kind of revolutionary now, really.
Oh, it's amazing. I mean, I think the technology's changed a lot, and it's been really fun to be able to bring that out in the community.
I understand that varicose veins, for the most part, are hereditary, but are there some things that kind of exacerbate it?
There are. For a lot of people, it is hereditary, but
Yeah.
certainly pregnancy is a big part that we'll see that, hormonal changes, and just, I think, wear and tear of those valves opening and closing over your life.
Oh, wow, yeah. Is there an ideal patient for these treatments?
I think, what's nice about this procedure is it can be performed in a wide range of ages.
Right.
And so it's great for the younger people that want to get up and going again, and then for the older folks that are suffering, that need procedures that don't have a lot of impact. So it's really nice for that.
Do you do other vein treatments as well, like spider veins, that kind of thing?
We do spider veins. We also treat blood clots, and
wow.
so some people that will develop blood clots, we'll see them as well. We also treat a lot of people for leg swelling, or what we call edema, and also if you've seen people wearing shorts and they'll get that dark discoloration on their lower legs.
What is that?
That's called venous stasis changes, and that's just slow kind of staining of the skin that happens with the blood pooling in the legs. We treat that as well.
So you can get rid of that stain?
Well, it's hard to get rid of it completely, but it will improve.
And what causes that, by the way?
Just it's the blood pooling in the leg, and then actually the iron from the red blood cells gets into the skin.
Wow, that's incredible.
Yeah.
So you said there is really no downtime. People after the surgery can leave, go home, and just kind of take a couple aspirin, be fine?
Yeah, we usually recommend compression stockings for a few days,
Okay.
and also ibuprofen, but
Yep.
for people that can tolerate it. But yeah, essentially very little downtime.
Yeah, that's fantastic. The results are amazing.
Yeah.
They really are. If people would like to find out more, they can contact Inovia Vein Centers, 4 locations, Northwest Portland, Tigard, Happy Valley, and Bend. We'll put all that information for you on our website at KATU.com. Dr. Gilster, thank you very much. Appreciate
you.
it.